is Dhona. I'm 48 years old. I'm happily married with 2 boys, and even before my diagnosis and surgery, I lived a healthy and active lifestyle. I had to go to the emergency room with my husband because I had an experience of having like dizzy spells and headache, and I had the feeling of numbness on the left side of my face. They did an MRI to rule out if I had a stroke or something. I saw the result, and then it says there I had a mass in my brain. It's a meningioma. I've never known anyone from my family or my friends who had this kind of medical diagnosis. I asked a question in that Facebook group, like if they've known any skull-based neurosurgeon. Then she recommended me Dr. Walavan Sivakumar from Pacific Neuroscience Institute.
Donalyn is a very sweet patient of mine who came in with a very scary situation. She was found to have this sizable brain tumor at the base of her brain, growing into very difficult to reach locations and pressing on her brainstem. She was an avid marathoner and trainer and incredibly active, and her husband were these very energetic people who had a real zest for life. So this idea that this potentially very dangerous tumor can put a limit or take her away from these dreams of activity into her later years was very, very scary.
Having that medical diagnosis really scared me a lot. My symptoms at that time, it was largely concentrated on the left side of my head. Living with that was really emotionally exhausting and very, very, very scary.
I wanted to try a very systematic approach. You know, with brain tumors, most of the time you don't usually have the luxury of time. You find a brain tumor because there are problems going on and you have to go immediately to surgery. Whenever possible, I try to give patients and their families and their support systems as much time as possible to prep themselves for future success. And she was able to take a very stepwise, systematic approach to preparing for surgery, which included multiple visits with us, visits with other doctors to prepare herself and make sure she was making the right decision, and physically making sure she was in the best possible condition heading into surgery.
He's so professional, very warm, very confident, very knowledgeable. He thoroughly explained to me the medical diagnosis, and he just didn't see me as a patient. He saw me as a person. He's very compassionate and he's very confident. All of my fear really had started to lift. He discussed the approach that he would plan to do for me, which is the minimally invasive approach. That's what I call the Keyhole retrosigmoid craniotomy.
We were able to achieve all the goals that we wanted for the surgery, and she recovered remarkably well.
Just 2 hours after my surgery, I was actually up and walking in the recovery room, and I was discharged the next day. And just 3 days after my surgery, I was actually up and walking again at the park.
She was up and working with the therapist immediately after a very long surgery. After surgery, she was able to manage her pain with our comprehensive enhanced recovery protocol. And she and her husband felt well enough and confident enough to go through the post-operative process and leave the day after surgery. That is now our norm, but it really is a rarity in terms of general neurosurgical care. I was really, really impressed to see that she was out doing more runs and marathons, a few short weeks after surgery, including our brain tumor walk, to raise money for brain tumor research. So she has really positioned herself to not only be a remarkable patient with a successful outcome, but also an advocate for brain tumor patients moving forward.
My recovery is a testament to the precision of my surgery. Every mile that I run, it represents how far I've come and how fortunate I am to have received such excellent care from Dr. Sivakumar and the entire team from Pacific Neuroscience Institute. He gave me hope, courage, and strength, and a second chance to live life fully and giving my life back and to be with my family.